Those who crossed paths with Tucson gunman Jared Lee Loughner say that warning signs were accumulating. But in our third story tonight, are signs and signs alone enough to forcibly remove American citizens from society against their will? Former New York Mayor Rudy Giuliani trying to turn the Loughner story into an excuse for some kind of roundup.
We're making a big mistake here, not changing our procedures with regard to mental illness and then some form of involuntary appraisal of people who display situations where teachers have to have guards there to protect themselves.
After posting an incendiary video about his college on YouTube, Loughner was suspended from campus until he was to receive a mental health evaluation. Instead, he never sought the help and left the school. Richard Castigar, a top official in the Pima County Sheriff's Office, said that Loughner's behavior at his college never violated the law.
He was disruptive in a Pima College classroom. And I personally don't want a police state where anybody who's perhaps has an opinion or stands out in their classroom or does something goofy in their classroom gets arrested and then put in some kind of a mental rehab system.
On the one hand, the argument that Jared Lee Loughner displayed obvious mental illness yet was never forced to seek treatment. On the other, that Loughner's behavior, however bizarre, should not lead to new restrictions on our fundamental liberties. Complicating the matter is that funding for behavioral health treatment in Arizona was cut by as much as 50% last year. According to the National Alliance on Mental Illness, that gutting denied mental health services to nearly 28,000 Arizona residents. The executive director of the Southern Arizona chapter of the National Alliance on Mental Illness joins us now, Dr. H. Clark Romans. Thank you for your time tonight, Doctor.
Glad to be here. Thank you.
This fundamental question first of when to intervene, is it actually irrelevant if the funding isn't there to do anything with the people with whom you think about intervening?
Well, I think it's a checkerboard situation. I think the regulations that are on the books in Arizona can be useful tools for people to help them and help others get help for them. The difficulty with the budget cuts is that oftentimes when people are involuntarily committed, the money may not be there when they get out of the hospital to give them continuation of care.
Tell me more about the budget cuts. Give us some sort of perspective. Besides no follow-up or limited follow-up when people get out of that immediate emergency sort of care, what specifically is not happening?
Well, I would say here in Pima County, beginning as early as January 1st, 2010, some 2,800 people were expelled from the public mental health system because they did not have a serious mental illness diagnosis. That was the first wave. The second wave came on July 1st of 2010, where individuals who did have a serious mental illness diagnosis but weren't poor enough, in other words, they didn't qualify for Medicaid, called Access here in Arizona, those individuals lost virtually every service that they were getting except generic medications. So they lost access to their doctor, their case manager, support groups, outpatient services, transportation subsidies, and eventually housing subsidies. So essentially they were kicked out except for generic medication.
In an ideal situation, full budgets and such, what could have happened differently with Loughner other than something that involved him volunteering or agreeing to be treated?
Well, I think that there was enough evidence, at least from what I've read. Obviously, I don't know everything, but there are several categories in the Arizona statutes which allow for involuntary commitment. The most obvious one is a danger to self or others, but apparently he didn't demonstrate that. But there's other categories which I believe campus officials or campus police could have used. My agency works with law enforcement and with other mental health provider agencies, and people are involuntarily committed on these other categories on a regular basis when the circumstances deem it necessary. It's not an arbitrary process, it's a thoughtful process. It's a tool that can be used.
Is there any way to say how much likelier that another Loughner might be out there because of these budget cuts, or is that just too simplistic a question?
Well, I think that the fact that people who are making more, at least for the moment, more than 100% of the federal poverty level, are now in a category that they have virtually no access to services, to public mental health services. So I think we've raised the barrier considerably higher than it used to be. So people who you know, could be unstable are at risk. I mean, the fact is that most people who do have serious mental illnesses go through their life undiagnosed and untreated. So any of those people could at any time be in a situation where the stress precipitates their symptoms and the services are moving further away from them.
H. Clark Romans, Executive Director of the Southern Arizona Chapter of the National Alliance on Mental Illness. Great thanks for some of your time tonight, sir.
You're welcome.